crest. So it starts up here. So here's the PSIS, which is my prominent bony landmark. So the muscle starts just a little bit superior to that. It's going to start right about here. It's going to come down onto the PSIS. It's going to come onto the lateral edge of the sacrum, and the lateral edge of the sacrum is a bony landmark that I can easily feel. If I just kind of sink into the glute and kind of go down and then in towards the midline, I'll bump right into that edge. And I think of the sacrum kind of like a triangle, like it's coming down towards towards the coccyx, and so I can feel edge, 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 whoop, where it kind of sinks in quite dramatically, and that's the top of the coccyx. That's where I'm going to stop my palpation. Okay, so I can feel this, I can feel this, I can feel this. I'm not going to actually palpate her coccyx, but I can palpate the top of the coccyx, which is where, as I'm feeling this bony edge, it feels like there's like a sharp indentation along the edge of the bone. Okay, so that's the origin. The insertion.
Could you say again where you would start your palpation?
Just above the PSIS on the iliac crest. So posterior iliac crest, PSIS, lateral edge of the sacrum up to the top of the coccyx is where are the bony landmarks that I can feel for the origin. It's attaching like right here. The shape and fiber direction is running down and lateral, inferior and lateral, parallel fiber directions. And I told you that if it was something other than parallel, I would tell you. So at this point, assume parallel unless told otherwise. And then the upper fibers are going to attach into the IT band. And these lower fibers are going to attach onto the gluteal tuberosity. Remember, the gluteal tuberosity is named after the gluteus maximus. And the gluteal tuberosity is, my linea aspera is on the back of the femur, and those lines run parallel, and then towards the top, they split. There's the lateral portion of the split that heads towards the greater trochanter. That is the gluteal tuberosity. So on this femur bone, there is an actual little bump, but then there's just slightly below the bump as well is sort of that lateral portion of the Y. So this is the gluteal tuberosity. You're not going to necessarily like feel, it's not like feeling the greater trochanter where you're like, whoa, there's a bony landmark there. What you are going to do, and what I'm going to ask her to do, is I'm going to find the greater trochanter. I'm going to get onto the back of the greater trochanter. I'm going to slide inferiorly off the greater trochanter. That's what I can feel. And then I'm going to ask her to extend her hip, and I should feel a really strong tendon pop up underneath my fingers. That make sense? Mm-hmm. So that's how I find the insertion point, is not, ooh, there's the gluteal tuberosity, I can feel it. It's, here's the trochanter, I can feel that. I'm going to get onto the posterior aspect of the trochanter, and then I'm going to slide inferiorly off of it, and then I'm going to ask the client to extend their hip. Okay, so that's what this is all going to look like. I'm going to be on this side, Allie.
Okay.
Gluteus maximus is definitely where back of leg drape really counts. So having a nice clean drape, so making sure that it doesn't get all bunched up. And then my preference, I'm not sure how your massage teachers are teaching you, but my preference is when I take this salvage here, I like to take it and roll it under. Because if you roll it over, and tuck it, what's going to happen is that it's going to start to unroll, and then you're constantly fiddling with the glute drape, which is distracting for the client. But if you roll it under and then tuck it, it stays tucked. So it's nice and snug. Is that okay? Mm-hmm. And then what I did is I just took all this and I kind of pushed into the table and then kind of stuck it up underneath her belly a little bit so that I have a nice, secure glute drape. Okay. I want to get as much of the buttock uncovered as I can. Okay, so even though she's wearing underwear, I want to try to get the whole gluteus maximus muscle uncovered. Okay. In general, when we're doing massage, like unless the client expressly says like, please don't touch my glutes, like I don't give you consent for that, it's important to remember that the leg starts up at the iliac crest, and that when you're doing your massage, you want to give them that feeling of taking the stroke all the way up to their iliac crest. And you don't want to have to slide underneath the drape to do that, because that's sending a mixed message. So, and it's also fine, for clients to, keep on whatever clothing that they want to keep on. Okay. So, I've got my drape. It's nice and secure. I'm going to find her PSIS. The PSIS, the easiest way to find the PSIS is to actually use the heel of your hand and then just kind of swirl around sort of the back of the low back until you can feel that bony bump. And then once you feel like you found it, then come in with your finger pads. It's much easier to use this broad contact surface and then zero in rather than trying to do this. Okay? So her PSIS is right there. The iliac crest is kind of running in this direction. So PSIS, so just proximal to that is the posterior iliac crest.
So really the origin's that iliac crest, not that PSIS.
Right. Well, it's on the PSIS, but the PSIS is the good place to start. So it starts here on the posterior iliac crest, comes down to the PSIS, and then it hops down onto the lateral edge of the sacrum. So I'm going to sink into her glute tissue, down towards the table, and then in towards the midline, and I can feel this little bony edge of the bone of the sacrum. And again, I'm thinking that it's a triangle, so it's the edge of the bone is angling medially. So edge of the sacrum, edge of the sacrum, edge of the sacrum, and there's like a little whoop right there, which is that top of the coccyx. Okay, and that's where I'm going to stop. Does that feel okay so far? In general, I don't know if that answers your question, George, around like how
I was looking at are you talking about the PSIS or are you talking about the
I'm just kind of tacking back to your question about like draping
Oh,
shorts
yeah.
and that kind of
Yeah.
stuff. Okay.
No, yeah, I was just wondering if I needed to get into different clothing because my jeans are, or if
Yeah.
we were just going over it or,
Yeah.
you know.
Okay.
Gotcha.
So you're working into the buttock area. So when in doubt, like act as if you know exactly what you're doing. Use confident touch, like I'm feeling for bony landmarks. Okay. If you stay on the bony landmarks, any sense of discomfort or what the hell are you doing back there tends to go away. If you're not sure what you're doing and you act as though you don't know what you're doing, you're kind of like, it feels just like someone's like poking you in the butt. Okay? And you may have, everyone's going to have different responses to that. So, so what I'm wanting to also sort of keep in mind here is like just use clear intention, like there's a bony landmark, there's a bony landmark. I'm not sure if I'm the bony landmark, but I'm going to act as if I am. Like, and so sort of fake it till you make it. So if your palpation skills still feel like, I don't know what I'm feeling underneath my hands. I don't know what I'm feeling underneath my hands. Ask your client, like, the client might be like, yeah, that doesn't feel like you're on bone. That feels like you're on bone. So have it be dynamic and communicative and, get your partner involved in what you're doing so that, that it's clear what your intention is. Okay. Shape and fiber directions running in this direction here. So inferior and lateral. The top portion here is attaching into the IT band. And then this lower portion is attaching into the gluteal tuberosity. So the gluteal tuberosity palpation goes like this. I'm going to find the greater trochanter, which is on the side of the hip, right? And think of it like a ball. So it's kind of like a basketball. So I found the lateral side of the basketball. Now I'm going to get onto the posterior side of the basketball, which is right here. And now I'm going to go inferiorly and fall off the basketball, which simultaneously also lines up with the gluteal fold, where the buttock turns into the thigh, is a good sort of point. And so I'm right there. I'm on the femur. I'm no longer on the trochanter. And Allie, what I'd like you to do is I'd like you to bend your knee for me just a little bit. Yep. And now lift your knee off the table. Boom. And there's a big tendon that pops up underneath my fingers. That's the gluteal tuberosity. Okay. So the location of the gluteal tuberosity is inferior to the posterior greater trochanter. Does that make sense? Mm-hmm. Okay. So it's inferior to the posterior greater trochanter. So greater trochanter, normally we find it on the side, right? And then we have to get onto the back of it. And then we have to go inferior off of it, and it's right there, and it's also kind of right in line with that gluteal fold.
I saw a guy in a video hold up the leg, and so it was flexed, and kind of move it medially and laterally to find the greater trochanter kind of move.
Yep. Yep.
Well, it's
That's
kind of
also a trick. If you
Way to-
can't find the trochanter, bend the knee, and then if you internally and externally rotate the hip, you should feel the trochanter move underneath the palm of your hand or the heel of your hand. Okay. Okay. So there's my origin, there's my insertion, there's my fiber direction. Okay. Actions are hip extension and lateral rotation. To engage this muscle and fire it, again, I'm gonna ask my client to bend her knee less than 90 degrees. If a client bends their knee like this, then I ask them to lift their knee, chances are high that they might get a Charlie horse. So keep the angle of the knee a little bit more obtuse rather than acute, like that. Allie, hold that position there. Now I want you to just gently lift your knee up off the table. Again, I didn't ask her to extend her hip, I said lift your knee off the table. I'm using language that a regular client could understand. And then when she's doing that, I can see and I can feel this gluteus maximus firing. It's a very big, very thick, very powerful muscle, very superficial, and it's the most posterior of the glutes. So if I get too far lateral, I'm gonna start to lose it a little bit. It's not gonna feel quite so thick and dense. So I want to stay sort of on this posterior, thick, dense part. Okay, go ahead and let your knee fall back down. Okay. If I just said straighten your knee and then lift your straight leg up, that's not wrong. But what I'm getting is I'm getting a lot of hamstring, and her glute is a lot more squishy now. So if I bend the knee, what does that do to the hamstrings? It sort of disengages them, and now when I ask her to lift her knee, she's using more of her glute. Okay. So again, just saying raise your leg up off the table is not wrong. You just get a little bit more of a refined gluteus maximus palpation if you start with a bent knee, because now the hamstrings can't work as hard. They are focused on the knee, and the gluteus maximus can focus on the hip. Okay.
Distract them.
Yes, that we're giving them something else to do.
Uh-huh.
It's like, having small children. You don't want to play with that electrical outlet. Here, play with this toy instead. Oh, cool, a toy. Shortened shortened position for massage. What do you think?
Shortened position for massage.
Yes, how would we shorten this muscle?
Well, you could, yeah, and you could rotate it by just medially rotating it, you would get it lengthened, right?
Yes.
And then if you laterally rotated it, you would get it shortened. So you could kind of do both if you wanted to.
So I'm going to show you a position that you will be using a lot in your more advanced massage techniques. It's called frog leg. Most of you have probably experienced this just from laying on your belly, like at the beach or on your bed or watching TV. So, and it's going to be basically this position here. So you're going to be sort of in an externally rotated and abducted position. In order to get your client into frog leg, there's a couple steps. Bend the knee, take your lower hand, cradle the ankle, and then your hand is going to be on the inside of the knee like this. Okay. Top hand is going to be on the side of the glute, and I also like to just kind of hang on to the sheet too. So I'm going to be here, and then this hand's going to just take the glute and start to roll it this way, and this hand's going to start to do this. So it's kind of like turning the wheel of a school bus. So I've got the sheet so that we don't get any gaps. And then I turn the wheel of the school bus. And I like to get the knee. So there's different, like some people go here. I actually find that the more I flex the hip and get the knee closer to the shoulder, the more comfortable it is. What this does is it sets the head of the femur a little bit more snugly into the acetabulum. And so because this this person is in abduction. She's in abduction and she's in lateral rotation. It's bringing the origin and insertion closer together, which is shortening the muscle. Okay. So frog leg is a really nice way to work the glutes. The other nice thing is that when we get to those other two glutes, the lateral glutes, the medius minimus, it also kind of brings them a little bit more underneath our hands instead of having to like, you know. Okay, so now I can do some massage. I'm massaging right along the edge of the sacrum. I can massage up to that PSIS. I can massage in that posterior gluteal region to get the gluteus maximus. I can use fists. I could do petrissage. Okay. So this is a nice way to work hip stuff.
I have two questions. So,
Yeah.
one was just that, so when we think about the glute, I mean, I think about the whole set of glutes. I get why that's a good shortened position when I think about gluteus max.